So, I think it's really important. Somebody told me this once, and I think that it's really important to remember that not all patients necessarily want to participate in the clinical trial, but most patients do want a doctor that is involved in innovative research. And so maybe that isn't participating in the enrollment of a research trial or research study, or maybe it is participating in the actual enrollment of a research study. So maybe it's just kind of staying up to date on publications and research that's out there. But sometimes that can get really daunting, reading through publications and research studies. And so I think it's always helpful to kind of review what makes a good study, or when I'm reading through something, how do I know that it's a good study? Seth, do you have any specific suggestions for that?
Yeah, so I think, anytime that you're reading any sort of article or especially like a publication, so many people I feel like just will glance over the abstract, or they'll just glance over the final discussion notes, and they'll read that and go, okay, I think I've taken everything that I need out of this. But it's actually really important to try to look through the guts of the study, if you will, because you can just read through that discussion, but if you don't understand exactly how that study was designed, then you might be missing certain features of it. And whoever writes the article or publishes it, they're supposed to give themselves a fair review. But there's certain things that could give you maybe a better understanding of what you really should take away from the article that you're reading. But even just for a brief example, the DREAM study, dry eye assessment and management, when they were looking at omega-3 supplementation for dry eye symptoms, they're specifically looking at omega-3 supplements with 400 milligrams of EPA and 200 milligrams of DHA, and they're comparing that to a placebo group. And if you just look at the results, the treatment arm, if you're grading their ocular surface disease index scores, that treatment group had a pretty significant improvement by an average of 13.9 points on their ocular surface disease index scores. And if you compare that to the placebo group, though, the placebo group also had a fairly significant improvement of 12.5 points on average. And this might raise some questions of, did the actual treatment itself work, or was it a placebo effect also in the treatment group? But then if you actually read through the study and dig a little bit deeper, that placebo group, they were receiving 1,000 milligrams of olive oil. That was their placebo. And now you can ask questions of, well, now does this pose potential for, does olive oil itself, does that cause an improvement in symptoms? You can kind of break it down a couple different ways, and it opens the door for potentially another treatment with a slightly different design, because you don't want to walk away from this saying that, well, it was the same, the treatment group was the same as the placebo group, and does that mean it didn't work? No, it doesn't mean that it didn't work, but you probably want to get more information long term to feel a little bit more confident with the results of the study.
Yeah, I think that's right. We can't always just take the surface level information. It's important to understand and dive deeper in the actual details of the clinical research. So I'm just going to kind of take us back to two things here. One, I wanted to touch too on studies that we enroll in from a refractive standpoint, laser standpoint. Maybe not all of our sites are always enrolling in the exact same studies, but some are enrolling in studies that are more pertinent to the care that they specialize in. And some of our sites are enrolling in, laser studies, refractive studies here and again. And one currently that I can think of is, a laser study for the treatment of hyperopia. And I'm always hesitant to get too much into detail of the specific studies that we are enrolling in, only because it constantly feels like those are changing based on enrollment goals. But I do think it's important to highlight, we always seem to be enrolling in cornea studies. We always seem to be enrolling in IOL studies, as Seth mentioned. We always seem to be enrolling in glaucoma studies. We always seem to be enrolling in corneal refractive procedures in some capacity, which is very consistent kind of with the areas of eye care that we provide. here in Sioux Falls, maybe we'll start leaning into retina and oculoplastics, but that's to be determined. Something else that I think is really interesting from a research perspective is that cornea, you kind of touched on this because we're enrolling in a study, epithelial on cross-linking, but we were also involved in the pivotal studies that led to the FDA approval of corneal cross-linking. And if we can believe that or not, that was just in the FDA approval came in 2016. So that's not even 10 years ago. And I think cross-linking for me is one of those things that really sheds light on the importance of clinical research, because if it weren't for somebody thinking about UV light and how that could help protect the cornea from further progression, we would still be counseling patients who with cross-linking that, hey, there's nothing that we can do about this right now. We just have to watch for change. And eventually you might need a corneal transplant. And oh, by the way, you have a 50% chance of that failing after in 10 years. And so cross-linking, thankfully, we don't really have to have that conversation with patients anymore. We get to say, there's a treatment that's FDA approved that's going to help prevent that. And I just think that that's such a powerful thing to think about. And so here we are, not even 10 years later, kind of evolving that treatment yet again to ensure that efficacy is staying the same and hopefully reducing some of the risks that can be associated with that.
So Kayla, if somebody is, curious, what VTV site nearest to them is enrolling in right now as far as clinical trials, is there somewhere that they can find that?
Great question. We do. We have a portal, thompsonvision.com/OD. So please feel free at any moment to kind of look into that to see what studies that we might be enrolling in. And that's going to tell you studies across all of our sites. And don't feel that you should be limited by one site that's local or within, that's closest to you. It's not uncommon that sponsoring companies, because they are looking for, certain patients to meet enrollment, oftentimes they might reimburse for mileage. So just something to be, considering when you're counseling your patients on any potential research that they might be a candidate for.
Yeah, and I believe on that OD portal as well, it gives the contact information for some of our research coordinators at each site. So if it just comes down to, if you're looking through the study and you're even looking through that inclusion exclusion criteria that's listed up there, and if you're still unsure if your patient is a good candidate, you can always call over and discuss with one of our research coordinators, or you can even just send the patient over for a screening. The worst that can happen is we say that, no, you're not a good candidate right now, but we'll keep an eye out for something that you might be a better candidate for in the future.
Yeah, that's a great point. And honestly, being solely dedicated to research, I'm often intimidated by the inclusion exclusion criteria. And so thankfully, we get to work with a great team of research coordinators who dig into that on a very deep level. And so I think that if you have a patient who you're considering, would be a candidate for research, and I would just encourage you to send them over, because that inclusion exclusion list is one to be reckoned with. So in wrapping our conversation up here, and it's been a real pleasure to talk about all things research with both of you. Seth, I think you bring tremendous experience from a clinical perspective. Tiffany, you've got fantastic regulatory perspective. And so circling it all back here, what's a study or clinical research study that you are thankful to be enrolling in current state, and anyone that's coming in the future? Or maybe it's not even an enrolling study, but just something in research that we're looking forward to from the future. I'll let Tiffany kind of start.
I'm excited about cell and gene therapy in ophthalmology. I have seen what cell and gene therapy have done in other healthcare entities, so I'm really looking forward to a study right now we have at VTV that is a combination of a cell therapy and a small molecule. But furthermore, I'm excited about potentially some gene therapy clinical studies in retina.
Yeah, something that we've been involved with here in West Fargo is this is another kind of treatment for Fuchs dystrophy study, but it's called the diabetic endothelial keratoplasty study. And, we're specifically looking at the outcomes of patients who receive a endothelial transplant from a donor who had diabetes. And to be honest, we're not expecting to see any sort of issues with this study. We're not expecting to see any problems with people not being able to withhold the graft, but we're actually expecting to see positive results. And this is so important because there are tissue labs that will not harvest that endothelial cell or that endothelial graft from someone who does have diabetes. And that's very much usable tissue. And if we can prove that is safe to transplant into somebody, then that just means there's more tissue that can be harvested, and it decreases the chances of somebody needing to have to be on a wait list or anything like that for the transplant that they need.
And anything that you're looking forward to in the future?
There's been some talks about some studies that are revolving around limbal stem cell deficiency. That's exciting because that's one of those tough conditions where a lot of times you can try everything. There's no great cure. And if there's a new tool in the belt to treat that condition, then that can be extremely helpful for those really, really tough cases.
Yeah, definitely. I think that's a great point. And we're probably continuing to learn more and more about limbal stem cell deficiency. I think another area, that we're learning more and more about is neurotrophic keratitis. And anything that, is cornea involved, I think is exciting. I think it's kind of simple, but some of my favorite studies are IOL studies, mainly because we're continuing to help improve that technology. But you really also see patients who otherwise maybe wouldn't have the opportunity to experience something like that. And those studies often provide patients that opportunity. And it's, what we do. And so continuing to see that technology improve, whether it be less side effect or whether it be better outcomes from a residual refractive error standpoint, or maybe it's patients are continuing to get more and more or less and less dependent on glasses, range of vision. So, kind of a simple thing, but I think that that's very exciting. Well, we've been honored that you've spent your last hour listening to the Advanced Patient Care podcast, and hopefully we've been able to bring you the latest advancements in cutting edge research and practical tips that you can apply to your practice right away. So if you have any questions, please don't hesitate to ever reach out. And again, we'd love it if you would take the time to review our portal that goes over all of our research that we are participating in here at Vance Thompson Vision.